If you're on a fertility journey and wondering whether IVF or IUI is the best fertility treatment for you, you're definitely not alone. Deciding between these fertility treatments can feel overwhelming, especially when both come with their own success stories and challenges. So, how do you figure out which fertility treatment is right for you? I am V, and in today's video, we're going to compare the key differences between IVF and IUI. We'll break down the IUI process, discuss IUI success rates, and explore how IVF stacks up when it comes to success rates, time commitment, and overall effectiveness. By the end, you'll have a clearer picture of which option might be the best fertility treatment for your situation. Whether you're just starting to explore fertility treatments or deciding between IUI versus IVF, this video will help you make an informed decision. So let's dive in. But before that, make sure to click the like button and subscribe to the channel. Let's start with IUI, which stands for intrauterine insemination. This is one of the more common and less invasive fertility treatments. The IUI process involves placing sperm directly into the uterus during ovulation, giving the sperm a better chance to reach and fertilize an egg. Many people choose IUI as their first step because it's simpler, less expensive, and requires less medical intervention compared to other treatments like IVF. But how effective is it? Well, the IUI success rate depends on several factors, such as age, the underlying fertility issues, and how many cycles you go through. On average, the IUI success chances are around 10 to 20% per cycle for women under 35. For those over 35, success rates can drop. However, with the right timing and a bit of luck, many couples have had success stories through this treatment. There are a few tips that can help increase your chances of success with IUI. Things like tracking ovulation carefully, following your doctor's advice closely, and maintaining a healthy lifestyle can all contribute to better results. Some women also experience certain IUI success symptoms like mild cramping or spotting, which can sometimes be a positive sign after the procedure. Now let's talk about IVF, or in vitro fertilization, which is one of the most well-known fertility treatments. Unlike IUI, where fertilization happens inside the body, the IVF process involves retrieving eggs from the ovaries and fertilizing them with sperm in a lab. Once the embryo develops, it's then transferred back into the uterus. One of the key advantages of IVF is its higher success rate, especially for those with more complex fertility issues. For women under 35, the IVF success rate is about 40–50% per cycle, but like with IUI, age and underlying conditions play a big role in these numbers. As you can imagine, this makes IVF a more common choice for those who haven't had success with IUI or other treatments. Another thing to keep in mind is that IVF requires a more involved process, from hormone injections to monitoring egg development, so it tends to be more physically and emotionally demanding. But for many, the higher success rates and control over the fertilization process makes it worth considering, especially when compared to IUI. Interestingly, some people also wonder about the differences between IVF versus natural pregnancy. In IVF, fertilization happens outside the body, whereas with natural pregnancy or IUI, it occurs inside. Both can lead to the same result, a healthy baby, but the paths are different, especially for those struggling with fertility. So, now that we've covered what both treatments involve, let's compare IVF versus IUI more directly. Both are popular fertility treatments, but they work in very different ways and are suited for different situations. When it comes to invasiveness, IUI is less complex. It's often the first step for many couples because it's less physically demanding, requires fewer medical interventions, and is generally more affordable. The downside is that the IUI success rate is lower compared to IVF, especially if you have more complicated fertility challenges. On the other hand, IVF is more involved, but the higher IVF success rate makes it a better option for couples who've tried other methods without success. It's also often recommended for those dealing with issues like blocked fallopian tubes or severe male infertility, where IUI might not be effective. In terms of costs, IUI is typically more affordable than IVF, but because of the lower success rates, some couples may need multiple cycles to conceive, which can add up over time. IVF, while more expensive up front, can sometimes lead to faster results, especially when time is of the essence. So, when considering IUI versus IVF, it really depends on your specific situationage, fertility issues, financial situation, and emotional readiness. One isn't necessarily better than the other. It's about finding what works for you. And if you're wondering about the IUI versus IVF success rates, generally speaking, IVF has a higher success rate, especially for women over 35. But again, success can depend on so many factors. So which fertility treatment is better, IVF or IUI? The truth is, there's no clear-cut answer because it all depends on your unique situation. If you're looking for a less invasive and more affordable option, and if your fertility challenges are mild, IUI might be the best fertility treatment for you. It's often a great first step for younger couples or those without major fertility issues. Plus, the procedure is simpler and more accessible. However, if you've already tried IUI or other treatments without success, or if you're facing more complex fertility issues like blocked fallopian tubes, severe male infertility, or advanced age, IVF is generally considered a more effective option. The higher success rates of IVF, especially when other methods haven't worked, make it a better choice for many. Ultimately, the best approach is to speak with your fertility specialist to determine which option fits your circumstances. Both IVF and IUI have their strengths, and choosing the right path depends on your medical history, financial situation, and personal preferences. So, is one treatment better than the other? Not necessarily. It's all about finding the best fertility treatment for you. At the end of the day, both IVF and IUI offer hope and possibilities for couples struggling with fertility. The right choice will depend on where you are in your journey, the challenges you're facing, and what feels right for you and your partner. If you're still unsure, I definitely recommend consulting with a fertility specialist who can guide you through this decision based on your personal health and fertility needs. I hope this video helped you get a clearer picture of both treatments and which one might be the best option for you. If you found this information helpful, please give this video a thumbs up, and don't forget to subscribe for more content on fertility and health. And hey, I'd love to hear from you. Have you or someone you know gone through either IVF or IUI? What was your experience like? Thanks so much for watching, and I'll see you in the next one.